Good afternoon, everyone. Thank you very much for coming to this symposium, Satellite Symposium, sponsored by Tesaro, in which we are going to deal with emerging treatments for patients with cancer. And I would like to say welcome to everyone, not only to this symposium, but also to Madrid. For us, it's a great pleasure to have you in our city. I am a medical oncologist working now in Madrid, in Clinica Universidad de Navarra. I'm focused on gynecologic oncology for a long time. And for us, as I have said, it's a great pleasure to have you in our city. I hope you have a safe and nice stay in our country and in our city. Having said this, I think that I also have to remind you 2 or 3 important points. First is that you have some question cards with your documentation that you can fill out during the presentations and you can hand to the people of the staff in order to have some discussion after the presentations. The symposium is divided in 2 modules. I will explain you later, and we will have the discussion of the questions after each one of the modules. The second thing is that we have an evaluation form, and we would appreciate very much if you fill out also the form, provide us with your feedback, because that's very valuable for us as speakers and also for Tesaro in this type of meetings in the organization. It's very, the last point is please mute your phones if you haven't done it before. So I would like to introduce the symposium with a patient of my clinic. This is a 65-year-old BRCA wild-type woman that was diagnosed in January 2016 with FIGO stage 3C high-grade serous ovarian cancer that was suboptimally debulked. She received frontline therapy with paclitaxel and carboplatin in combination with bevacizumab 6 cycles, followed by bevacizumab up to 15 months. She finished the treatment in June 2017, and now in September 2017, she has a relapse with symptomatic peritoneal carcinomatosis, and in the CT we have also detected some mediastinal lymph nodes. So we have started second-line therapy with pegylated liposomal doxorubicin and carboplatin combination. So I have 2 questions. The first is, how can we improve the quality of life of our patient during the chemotherapy? And the second is, what can we do in order to improve the outcome of the patient after the chemotherapy? And trying to answer these 2 questions, trying to give some solution to our patient in these 2 specific moments of her disease, I would like to introduce the agenda of the symposium. The first module will be focused on the cancer-induced nausea and vomiting, and we have the participation of 2 experts, which are Florian and Saroj. We'll introduce them later. And the second part of the session will be focused on the niraparib as a maintenance therapy and what is the need of a patient that have responded to platinum and what are the needs that we think and she think that could be need to have